Can you give us an idea first? How did the pandemic disrupt organizations here in the Philippines? What
So
are the
it
major
has
things here
affected
that
a
you
lot.
saw over the past year?
At the onset of the pandemic, all organizations were not yet ready really to assume the role that we have right now. Everybody was caught flat-footed. A lot of businesses have to immediately scramble onto their feet in order to address the situation. It's a go between maintaining your business, operating, continue to operate, and at the same time upholding the principle of people first. You cannot compromise the health, wellness, and safety of your employees, but at the same time, you're driven to continue in order to sustain the operating expenses, especially the salaries of the employees. As we all know, a lot of businesses have closed, especially those belonging to the MSMEs. Even big organizations have to lay off people. In effect, it has affected the lives of many workers. A lot of workers have to be laid off. They were displaced and have to shift into other jobs in order to sustain their family expenses, etc. In other words, it's survival at its
Mhm.
finest during those early periods of the lockdown and the pandemic. So really, it has not just disrupted; it adversely affected the lives of many workers and of the businesses in our country. Not only in our country, but I guess the whole world.
Mhm.
Everybody was impacted.
But when you're into the pandemic, how have organizations adapted? And what do you think are the key trends here that allowed some of these organizations to actually survive?
It's like this. Not everybody, not all organizations would have sufficient funds to sustain their operations, much more pay for the salaries of the employees. We were encouraged by the Department of Labor to come up with ways and means, come up with flexible work arrangements. That's number one. So there's no one foolproof way of doing work already. So there could be skeletal force, there could be shifting, and everybody, almost everybody, around 80% shifted into digitalization. Companies have to send their employees home, start working from home. The first problem was connectivity, use of computers. How are we going to let our employees work from home if they don't have computers? So we have to acquire computers, even send them home with their own desktops, making sure that they are connected. Some organizations, like the organization where I belong, we can do remote work because of a system. We have a digital system in order to continue work. We call it team viewer, but not everybody would have that. Um, I guess there's no 100% foolproof system, but everybody has to come up with something in order to address the situation. In fact, there are large companies where they repurposed, they shifted their manufacturing. For example, they used to produce liquor, but because of the liquor ban, they have to produce alcohol instead and use the alcohol, sell them to medical facilities. In fact, donate a huge part of their production to medical facilities, hospitals, etc. And then HR has to take care of their employees, making sure they are safe, even at the confines of their homes, making sure that they have adequate medical attention, especially those who are experiencing mental illnesses. It's a concern that we have to deal with as HR practitioners, and we have to make sure that those who are affected by the virus, those who were infected, have adequate medical attention and medical supplies so that they are kept safe. And those who were infected and hospitalized can recover fully and go back to work.